All right, everybody, get ready because today we are diving into the world of adrenocorticosteroids.
Powerful stuff.
They're these hormones, and I think most of us have heard of them. We know they're important.
We know they're important, but I don't think we always know all the ins and outs.
Exactly. But that's what we're doing here. We're using basic and clinical pharmacology to help us out. This is the 14th edition, by the way.
Oh, wow. 14th edition. So they've had time to work out the kinks.
They've had time to work out the kinks. That's right. And this deep dive is going to equip all of you with the need-to-know info on these hormones, like what they do and why they should matter to you.
And the first thing to know is that these hormones are made in your adrenal glands.
Okay.
And you've got two of these. They're small. They sit right on top of your kidneys.
Oh, interesting. So they're kind of out of sight, out of mind.
They are, until they're not.
Until they're not.
That's right. And they're responsible for making a bunch of different hormones, but they can be grouped into three main types.
And those are?
We've got glucocorticoids, and the big one everyone knows in that category is cortisol. Then we've got mineralocorticoids.
Yeah.
And we have androgens.
All right, so let's break those down because they all sound pretty similar when you just list them off like that. Glucocorticoids, those are like the what?
Those are like your metabolic managers.
Okay.
They're involved in regulating energy use. They talk to your immune system.
Oh, wow.
And they're really important in the stress response.
Okay, so this is why people say that stress can mess with your metabolism or make you gain weight, stuff like that.
Exactly.
Because it's throwing the glucocorticoids out of whack.
Yeah, it can really throw things out of balance. So it all comes back to how our body processes, carbs, proteins, and fats. And cortisol is right there in the middle of it.
Okay, so that's glucocorticoids. What about mineralocorticoids? What's their deal?
They are essential for maintaining the balance of electrolytes in the body.
Electrolytes, those are the things we're always being told to replenish after a workout, right?
Yes, exactly.
Things like sodium and potassium.
You got it. And the key player here is aldosterone. Works behind the scenes to keep your sodium and potassium levels right where they need to be. And then we've got androgens, often linked to testosterone.
Okay, so this is where things get interesting for me because I've seen DHEA supplements everywhere.
Yeah.
And they promise everything, like increased energy, anti-aging. But I've also heard some mixed things about whether they actually work. So what's the deal with DHEA?
Well, you've hit on a very important point.
Yeah.
And that is that there's often a gap between what's claimed out there and what the scientific research actually shows.
Right.
While DHEA is a precursor to sex hormones like testosterone and estrogen, the research on its benefits is still being debated.
Oh, okay.
In fact, your textbook highlights a study where DHEA supplements didn't actually significantly impact muscle mass in older adults.
Interesting.
Which, you see that claim a lot.
Yeah, you see that claim a lot.
But the research doesn't always back it up.
And that's exactly why we're doing this, right? Because you can't just take these things at face value.
Exactly. You got to dig a little deeper.
Got to dig deeper, especially when it comes to something as complicated as hormones, right? So we were talking about cortisol, being a big part of that stress response. But I feel like there's got to be more to the story than just like fight or flight.
Oh, absolutely. Cortisol is involved in so many things. It's not just about those like acute stress moments.
Okay, so what else is cortisol doing when we're not running from a bear or something?
Well, a big part of its job is regulating energy use.
Okay, right. We were talking about that.
The metabolic stuff. So it's influencing how our body uses carbohydrates, proteins, and fats.
And blood sugar too, right?
Absolutely. Blood sugar control is a big one. And that's all connected to why stress can lead to, those cravings, changes in appetite, weight gain.
Yeah, makes sense. It's like when people say stress eating, it's not just in their heads.
Right. It's that cortisol throwing things out of whack. And on top of that, cortisol is also a powerful anti-inflammatory.
Okay.
And immunosuppressant.
So it's kind of like putting the brakes on the immune system.
Exactly. So it's preventing things from going into overdrive.
But then wouldn't that mean that if your immune system needs to be working, having too much cortisol would be a bad thing?
Well, that's why long-term use of medications that act like cortisol, like prednisone, has to be really carefully managed.
Got it.
Because you don't want to suppress the immune system too much. But beyond metabolism and immunity, cortisol is also doing things like influencing brain function.
No kidding.
Mood, sleep cycles.
Wow. So it really is involved in, like, everything.
It's a busy little hormone.
It really is. Now, speaking of these powerful effects, our book, Basic and Clinical Pharmacology, it talks about how scientists have created synthetic versions of cortisol.
Yeah.
Medications that are designed to, like, mimic or even amplify its effects.
That's right.
And they even talk about steroid synthesis inhibitors, which I thought was interesting because why would you want to block hormone production? It seems counterintuitive.
Well, sometimes, to figure out what's going on with a patient, doctors need to see what happens when you hit the brakes on certain enzymes involved in hormone production.
Oh, interesting.
It's a way of pinpointing the root cause of a problem.
So it's like a diagnostic tool.
Exactly.
Okay, that makes sense. But going back to those synthetic corticosteroids, these medications, are they used very often?
Oh, yeah, they can be incredibly useful for a wide range of conditions.
Like what?
Oh, things like inflammatory disorders, autoimmune diseases. Prednisone is a common one.
Right, prednisone. I've heard of that. But how do these synthetic versions actually differ from the natural cortisol our bodies make?
That is a key distinction. While they mimic the actions of cortisol, these synthetics, they're often designed to be more potent or longer lasting. Think of natural cortisol as like a gentle nudge, whereas some of these synthetics are more like, a sustained push.
Okay, so it's like they're designed to be more targeted,
Yeah,
more powerful.
Yeah, exactly. Which can be incredibly helpful for certain conditions, but of course it also comes with its own set of considerations.
Right, because like you said, you don't want to just mess with these things without being really careful, right?
Absolutely, and that's what makes it so important to get the dosage right. And then, if someone's on these medications long-term, monitoring is key. You want to make sure you're avoiding any potential side effects.
Now, our book actually dives into a really interesting case study that shows how all of this knowledge we're talking about is used in real life.
Oh, yeah?
Yeah, it talks about how doctors are actually using this information to diagnose and treat patients. And this specific case, it highlights a young man who's dealing with a whole bunch of symptoms. So we've been talking about synthetic corticosteroids and stuff, but this case study we were about to get into, it shows how it all actually plays out in a real person,
Yeah.
So our trusty textbook here, Basic and Clinical Pharmacology, it lays out this case study of a young guy, and he's dealing with like fatigue, weight loss, dizziness, all this stuff. And it turns out he's got Addison's disease. So first of all, what is Addison's disease? Like, what's going on there?
So Addison's disease, you might also hear it called adrenal insufficiency.
Okay.
It's when your adrenal glands just aren't producing enough cortisol,
Oh, okay.
or in some cases, not enough aldosterone. Remember that one?
Right. The electrolyte one.
Exactly. And this case study, it just shows you how important these hormones are for, like, everything.
Like those little adrenal glands are holding the whole system together.
They really are. And this guy, his symptoms, they were all because his body wasn't getting enough cortisol.
Makes sense.
It's like, without enough cortisol to do its job, things start to fall apart.
So how did they even figure out what was wrong with this guy? Like, how do you diagnose something like that?
Well, they usually do some blood tests
Yeah.
to check those hormone levels, see what's going on there.
Right.
And then there's this thing called an ACTH stimulation test.
ACTH, that rings a bell.
Yeah, so ACTH is a hormone that basically tells your adrenal glands to make cortisol.
Okay.
So this test, it measures how well your adrenal glands respond to it.
Interesting. So once they figured out, okay, it's Addison's disease, what do? How do you treat that?
The main thing is to give the body what it's missing, which is those hormones.
Okay, so synthetic corticosteroids
Exactly.
to kind of fill in the gaps.
Exactly. It's all about restoring that balance.
Mm-hmm.
But just like with any medication, getting the dosage right is really important.
Right, because too much cortisol can cause problems too, right?
Exactly. And long-term use, it needs to be monitored to avoid any complications.
Yeah, we were talking earlier about how long-term use of those synthetic corticosteroids can lead to other issues like iatrogenic Cushing's syndrome.
That's right. It's basically when your body is exposed to too much corticosteroid for too long,
Right.
and it ends up mimicking Cushing's disease.
Oh, okay.
So yeah, understanding those potential side effects, especially with long-term use, super important.
It really is about finding that balance, isn't it? Like, we've seen how important it is to have the right amount of these hormones in our system, and then how we have to be really careful when we're using medications that affect them.
You got it. It's all connected.
Well, this has been quite the deep dive.
Yeah.
We started with fight or flight, and now we're talking about, like, the subtleties of hormone balance.
It's amazing how much is going on in there.
It really is. And, I think what's so important for everyone listening is that hormones, they're like these powerful messengers in our bodies.
Absolutely.
And understanding them is really key to better health and well-being.
Couldn't have said it better myself.
So as always, thanks for coming along with us on this deep dive, and keep those brains engaged.